Hello and welcome to our comprehensive guide on managing osteoarthritis, especially for our senior viewers. Osteoarthritis, often simply called OA, is a condition that affects millions worldwide, and it can significantly impact daily life, causing pain, stiffness, and reduced mobility. It's often misunderstood as just a part of getting older, but that's not entirely true. While age is a major risk factor, OA is a medical condition that can be effectively managed, allowing you to live a fuller, more comfortable life. In this video, we're not just going to talk about the challenges, we're going to explore a wide range of practical strategies, from lifestyle adjustments and home remedies to advanced medical treatments. Our goal is to empower you with knowledge and actionable steps to reduce pain, improve joint function, and enhance your overall quality of life. We'll cover everything from understanding what OA is, its causes and symptoms, to detailed sections on what you can do at home, what medical professionals can offer, and crucial long-term prevention strategies. Remember, you are not alone in this journey, and there are many effective ways to regain control over your joint health. So, let's embark on this journey together towards better understanding and better living with osteoarthritis. To effectively manage osteoarthritis, it's crucial to first understand what it is and what causes it. Osteoarthritis is the most common form of arthritis, often referred to as wear and tear arthritis. It occurs when the protective cartilage that cushions the ends of your bones wears down over time. Cartilage is a firm, slippery tissue that allows nearly frictionless joint motion. When it deteriorates, bones can rub directly against each other, leading to pain, swelling, and loss of motion. It's important to distinguish between primary and secondary OA. Primary OA develops without an identifiable cause, usually due to aging and genetic predisposition. Secondary OA is caused by another condition, such as obesity, joint injury, or other medical conditions like rheumatoid arthritis or metabolic disorders. Let's delve into the specific risk factors. Age is the most significant factor. The risk of OA increases with age. Genetics also play a role. If your parents or siblings have OA, you're more likely to develop it. Obesity is another major contributor because extra body weight puts increased stress on weight-bearing joints like the knees and hips, accelerating cartilage breakdown. Joint injuries, such as those from sports or accidents, can increase the risk of OA later in life, even if they're treated. Repetitive stress on a joint from certain occupations or activities can also contribute. Other factors include bone deformities, certain metabolic diseases like diabetes, and even gender, as women are more likely to develop OA, especially after menopause. Now, let's discuss the symptoms. The signs and symptoms of osteoarthritis often develop slowly and worsen over time. The most common symptom is pain, which may worsen after activity or towards the end of the day and improve with rest. You might experience joint stiffness, particularly in the morning or after periods of inactivity. This stiffness usually lasts for less than 30 minutes. As the cartilage wears down, you might feel a grating sensation, hear popping or crackling sounds, crepitus, when you move the joint. The affected joint might be tender when you apply light pressure to it. There can also be some swelling around the joint caused by soft tissue inflammation. Finally, you may notice a loss of flexibility, making it difficult to move your joint through its full range of motion. And in some cases, bone spurs, which are hard lumps that can form around the affected joint. It's vital to remember that these symptoms can vary greatly from person to person and from joint to joint. Recognizing these signs early is the first step towards effective management and improving your quality of life. Now that we understand what osteoarthritis is, let's explore the powerful home and lifestyle strategies you can implement to manage pain and improve your joint health. These self-care techniques are often the first line of defense and can make a significant difference in your daily comfort and mobility. First, let's talk about exercise. It might seem counterintuitive to exercise when you're in pain, but regular, appropriate physical activity is one of the most effective ways to manage OA. The key is to choose low-impact activities that don't put excessive stress on your joints. Consider walking, swimming, cycling, or using an elliptical machine. These activities strengthen the muscles around your joints, providing better support and stability. And they also help maintain joint flexibility. Strength training, using light weights or resistance bands, can build muscle mass around the affected joints, further reducing stress. Always start slowly and gradually increase intensity. Flexibility exercises such as gentle stretching, yoga, or Tai Chi can improve your range of motion and reduce stiffness. Tai Chi, in particular, combines gentle movements with deep breathing, promoting both physical and mental well-being. Don't forget balance exercises, which are crucial for seniors to prevent falls that could injure already vulnerable joints. Always listen to your body and stop if you feel sharp pain. Consistency is more important than intensity. Next, weight management is critical. Every pound of body weight you lose can reduce the load on your knees by 4 pounds. Even a modest weight loss can significantly alleviate stress on weight-bearing joints and slow the progression of OA. This brings us to diet. Focus on an anti-inflammatory diet. Incorporate foods rich in omega-3 fatty acids, such as fatty fish, salmon, mackerel, flax seeds, and walnuts. Load up on fruits and vegetables, especially colorful ones, which are packed with antioxidants. Whole grains, lean proteins, and healthy fats like olive oil are also beneficial. Try to limit processed foods, sugary drinks, and excessive red meat, as these can promote inflammation. While research on supplements like glucosamine and chondroitin is mixed, some individuals report benefits. Always consult your doctor before starting any supplements, as they can interact with other medications. Heat and cold therapy can provide temporary relief. Heat, such as a warm bath, shower, or heating pad, can relax muscles and improve blood flow, reducing stiffness. Cold packs, on the other hand, can numb the painful area and reduce swelling and inflammation, especially after activity or during flare-ups. Experiment to see which works best for you. Assistive devices can make a huge difference in daily life. Canes, walkers, and crutches can take pressure off painful joints. In your home, consider grab bars in the bathroom, raised toilet seats, and ergonomic tools for cooking or gardening. Simple changes like using jar openers or reaching aids can conserve energy and protect your joints. Quality sleep is essential for pain management. Chronic pain can disrupt sleep, and poor sleep can worsen pain perception, creating a vicious cycle. Establish a regular sleep schedule. Create a comfortable sleep environment and avoid caffeine and screens before bed. If sleep problems persist, discuss them with your doctor. Finally, managing stress is crucial. Chronic pain can be emotionally taxing. Techniques like mindfulness meditation, deep breathing exercises, and guided imagery can help you cope with pain, reduce anxiety, and improve your overall sense of well-being. Consider joining a support group. Connecting with others who understand your struggles can be incredibly comforting and empowering. Remember, these lifestyle changes are not quick fixes, but consistent application can lead to significant improvements in your pain levels and quality of life. Take small, manageable steps and celebrate every victory along the way. While home remedies and lifestyle changes are powerful, there are times when professional medical intervention is necessary. Knowing when to seek expert help and understanding your options is key to comprehensive osteoarthritis management. Let's explore the range of professional medical solutions available. We'll start with medications. Over-the-counter, OTC, pain relievers are often the first step. Acetaminophen, like Tylenol, can help with mild to moderate pain. Non-steroidal anti-inflammatory drugs, NSAIDs such as ibuprofen or naproxen, available as oral pills or topical creams, can reduce both pain and inflammation. However, it's important to use NSAIDs cautiously, especially for seniors, due to potential side effects like stomach upset, kidney problems, and increased risk of heart issues. Always follow dosage instructions and consult your doctor. If OTC options aren't enough, your doctor might prescribe stronger medications. These include prescription-strength NSAIDs, duloxetine, an antidepressant also approved for chronic musculoskeletal pain, or tramadol, a mild opioid pain reliever, used with caution due to its addictive potential. Next, Injections can provide targeted relief. Corticosteroid injections directly into the joint can quickly reduce inflammation and pain, offering relief for several weeks or months. However, they are typically limited to a few times a year due to potential cartilage damage with repeated use. Hyaluronic acid injections, sometimes called viscosupplementation, involve injecting a gel-like substance that mimics the natural lubricant in your joint, aiming to improve cushioning and reduce pain. These often provide relief for several months. Physical therapy, PT, is an indispensable part of OA management. A physical therapist can teach you exercises to strengthen the muscles around the affected joint, improve range of motion, and enhance flexibility. They also provide education on proper body mechanics, posture, and ways to protect your joints during daily activities. Occupational therapy, OT, focuses on adapting your environment and tasks to make daily living easier and less painful. An occupational therapist can help you find assistive devices, modify your home or workplace, and teach you joint protection strategies to conserve energy and reduce strain. When conservative treatments no longer provide adequate relief, surgery might be an option. There are several surgical approaches. Arthroscopy is a minimally invasive procedure where a surgeon inserts a small camera and tools into the joint to remove loose cartilage, smooth rough surfaces, or repair minor damage. This is generally for less severe cases. Osteotomy involves cutting and reshaping bone to realign the joint and shift weight away from damaged areas. This can be an option for younger patients with localized damage. Joint replacement surgery, or arthroplasty, is the most common surgical option for severe OA, particularly in the hips and knees. The damaged joint surfaces are removed and replaced with artificial components made of metal, plastic, or ceramic. This can significantly reduce pain and restore function, offering a dramatic improvement in quality of life. Recovery involves extensive physical therapy, but the long-term outcomes are often excellent. Finally, let's briefly touch upon complementary and alternative therapies. Some people find relief with acupuncture, which involves inserting thin needles into specific points on the body. Massage therapy can help relax muscles and improve circulation. While these can be beneficial for some, it's crucial to discuss them with your doctor to ensure they are safe and don't interfere with your conventional treatments. Always prioritize evidence-based care and informed decisions when considering medical interventions. Your healthcare team is your best resource for creating a personalized treatment plan. Now, let's shift our focus to prevention and long-term management, a proactive approach that can make a profound difference in slowing the progression of osteoarthritis and maintaining your quality of life for years to come. Prevention often starts with early intervention. Recognizing the early signs of joint pain or stiffness and seeking medical advice promptly can allow for earlier diagnosis and initiation of management strategies. The sooner you address potential issues, the better your chances of preventing severe damage. Joint protection techniques are crucial. This involves learning how to move and perform daily tasks in ways that minimize stress on your joints. For example, use larger, stronger joints for tasks whenever possible, such as carrying a bag on your shoulder instead of in your hand. Avoid repetitive strain by taking frequent breaks and alternating tasks. Maintain good posture, whether sitting, standing, or lifting, to properly align your joints. Distribute weight evenly when lifting or carrying objects. It's about being mindful of your body mechanics. Regular medical checkups are fundamental to long-term management. Schedule regular appointments with your doctor or rheumatologist to monitor your joint health, assess the effectiveness of your treatment plan, and make any necessary adjustments. These checkups can also help identify any new issues or complications early on. Discuss your pain levels, mobility, and any concerns you have openly with your healthcare provider. Adapting your home environment can significantly improve safety and ease of movement, especially as OA progresses. Install grab bars in bathrooms, near the toilet, and in the shower. Use non-slip mats in wet areas to prevent falls. Consider raised toilet seats and shower chairs to reduce strain. Organize your living space to keep frequently used items within easy reach, minimizing bending and stretching. Ensure good lighting throughout your home, especially on stairs. Emotional well-being is often overlooked, but is vital when living with chronic pain. Osteoarthritis can lead to feelings of frustration, anxiety, and even depression. It's essential to acknowledge these emotions and seek support. Connecting with others through support groups can provide a sense of community and shared understanding. Don't hesitate to speak with a mental health professional, such as a counselor or therapist, who can offer strategies for coping with chronic pain and its emotional toll. Practices like mindfulness and meditation, as discussed earlier, can also be powerful tools for emotional resilience. Finally, staying informed is key. The field of medicine is constantly evolving, with new research, treatments, and management strategies emerging. Stay up to date by consulting reliable sources, attending educational workshops, and discussing new options with your doctor. Being an active participant in your care, advocating for yourself, and continuously learning will empower you to navigate your journey with osteoarthritis effectively. Remember, long-term management is a partnership between you and your healthcare team, with your proactive engagement being a cornerstone of success. By adopting these strategies, you can maintain a good quality of life and continue to engage in activities you enjoy. As we come to the end of our comprehensive discussion on osteoarthritis in seniors, we want to reinforce a central message. Living well with osteoarthritis is absolutely possible. While it's a chronic condition, it doesn't have to define your life or limit your joy. We've covered a vast array of strategies, and each piece of information is a tool in your personal toolkit for managing this condition. Let's briefly recap some key takeaways. We started by understanding that osteoarthritis is not just old age, but a medical condition involving cartilage breakdown, influenced by factors like age, genetics, obesity, and past injuries. Recognizing its symptoms early, pain, stiffness, reduced flexibility, is the first crucial step. Then, we delved into empowering home and lifestyle solutions. Remember the power of low-impact exercises, maintaining a healthy weight, and incorporating an anti-inflammatory diet. The use of heat and cold therapy, assistive devices, and prioritizing quality sleep are also vital components of daily self-care. We also explored professional medical solutions, ranging from over-the-counter and prescription medications to targeted injections, the invaluable support of physical and occupational therapy, and, when necessary, surgical interventions like joint replacement. Finally, we emphasized proactive long-term management and prevention, the importance of early intervention, adopting joint protection techniques, regular medical checkups, adapting your home environment, and, crucially, nurturing your emotional well-being. The journey with osteoarthritis is unique for everyone, and what works for one person might be different for another. That's why building a strong partnership with your healthcare team is paramount. Your doctor, physical therapist, occupational therapist, and even nutritionists are there to guide you in creating a personalized plan that suits your specific needs and goals. Remember, knowledge is power. The more you understand about your condition and the available management strategies, the more effectively you can advocate for your health and make informed decisions. Be patient with yourself, celebrate small victories, and stay positive. Maintaining an active social life, pursuing hobbies, and staying connected with loved ones can also significantly contribute to your overall well-being. We truly hope this video has provided you with valuable insights and practical steps to take charge of your osteoarthritis journey. Embrace these strategies, stay hopeful, and know that you have the power to reduce pain, improve your mobility, and enhance your quality of life. Thank you for joining us, and here's to a future filled with greater comfort, activity, and joy.